I don't think people understand what psychosis truly is. Psychosis is a complex mental health condition characterized by a profound disconnection from reality. Historically, psychosis has been misunderstood and often stigmatized. Early treatments were rudimentary and sometimes inhumane. Individuals experiencing psychosis may have difficulty distinguishing what is real from what is not, leading to hallucinations and delusions. This disconnection can cause significant distress and impairment in daily functioning, affecting relationships, work, and overall quality of life. Psychosis can be a symptom of various mental health disorders, including schizophrenia, bipolar disorder, and severe depression. It can also occur due to substance use or medical conditions, making it crucial to understand and address the underlying causes. Understanding psychosis is essential for providing effective treatment and support, reducing stigma, and improving outcomes for those affected. Symptoms of psychosis. First, hallucinations. Sensing things that aren't there. These can be auditory, like hearing voices. For instance, one individual described hearing a constant, critical voice that made daily tasks unbearable. This voice would often comment on their actions, criticize their decisions, and even insult them, making it extremely difficult to focus or feel at ease. Visual, such as seeing things. Another case involved a person who saw shadowy figures following them, causing immense fear and anxiety. These figures would appear suddenly and disappear just as quickly, leaving the person in a state of perpetual dread and confusion. Or less commonly, olfactory, like smelling things that aren't there, gustatory, tasting things that aren't present, or tactile, feeling sensations on the skin. One patient reported feeling bugs crawling on their skin, leading to constant scratching and discomfort. This sensation was so real to them that they would often injure themselves trying to get rid of the imaginary bugs. Next, delusions strongly held false beliefs that are not based in reality. Examples include paranoid delusions, believing others are plotting against you. A man once believed his co-workers were conspiring to get him fired, which strained his professional relationships. He would avoid meetings, refuse to collaborate, and even accuse colleagues of sabotage without any evidence. Or grandiose delusions, believing you have extraordinary abilities or importance. One woman was convinced she had a special mission to save the world, which led to risky behaviors and strained family ties. She would often make grand plans and take dangerous actions, believing she was invincible and destined for greatness. Then, disorganized thinking. Thoughts may be fragmented or illogical, making communication difficult. People may switch rapidly between unrelated topics or speak incoherently. For example, a young man's speech would jump from discussing his breakfast to a complex conspiracy theory within seconds, making conversations challenging. This erratic speech pattern made it hard for others to follow his train of thought or engage in meaningful dialogue. Also, disorganized behavior. This can include unusual or erratic actions, ranging from childlike silliness to unpredictable agitation. One individual would suddenly start dancing in public places, while another might become agitated without any apparent reason. These behaviors can be disruptive and confusing for both the individual and those around them, often leading to social isolation. Lastly, negative symptoms. A lack of normal functioning, such as reduced emotional expression, withdrawal from social activities, and apathy. A case study highlighted a person who stopped engaging in hobbies they once loved and became increasingly isolated. They would spend most of their time alone, showing little interest in interacting with others or participating in activities, or a decline in motivation. This can be seen in individuals who struggle to get out of bed or perform daily tasks, significantly impacting their quality of life. They may neglect personal hygiene, avoid responsibilities, and show a general lack of enthusiasm for life, making it difficult for them to function day to day. Causes of psychosis. Understanding the root causes of psychosis is crucial for effective treatment and prevention. Mental health conditions, schizophrenia, schizoaffective disorder, bipolar disorder, and severe depression are primary mental health conditions that can lead to psychosis. These conditions often require long-term management and comprehensive care. Substance use. The use of drugs such as cannabis, LSD, amphetamines, or experiencing alcohol withdrawal can significantly increase the risk of psychosis. Substance abuse can alter brain chemistry, leading to severe mental health issues. Medical conditions, brain injuries, dementia, infections affecting the brain, epilepsy, or certain neurological conditions can also be underlying causes. These medical issues can disrupt normal brain function, resulting in psychotic episodes. Trauma or severe stress. Experiencing trauma or severe stress can trigger brief episodes of psychosis, especially in individuals predisposed to mental illness. Early intervention and support are essential in these cases. Genetic factors. A family history of psychosis can increase the risk, suggesting a genetic predisposition. Genetic research continues to uncover the complex hereditary patterns involved. Environmental factors. Urban living, exposure to environmental toxins, social isolation, and childhood adversity can contribute to the development of psychosis. These factors can create a stressful environment that impacts mental health. Psychological factors. High levels of stress, poor coping mechanisms, and emotional dysregulation can also play a significant role. Psychological therapy can help manage these factors effectively. Interplay of factors. The interaction between genetic, environmental, and psychological factors can disrupt brain chemistry and function, leading to psychosis. Understanding this interplay is key to developing comprehensive treatment plans. Treatment for psychosis typically involves a combination of approaches to manage symptoms and improve functioning. This multifaceted approach ensures that all aspects of the individual's well-being are addressed, providing a holistic path to recovery. First, medication is a key component. Antipsychotic medications are the primary treatment for psychosis. These medications work by altering the effects of neurotransmitters in the brain, which can help to stabilize mood and thought processes. They help reduce or eliminate hallucinations and delusions, which are common symptoms of psychosis. Some examples include risperidone, olanzapine, quetiapine, and aripiprazole. Each medication has its own profile of benefits and potential side effects, and finding the right one can be a process of trial and error. Mood stabilizers or antidepressants may also be used if psychosis is associated with conditions like bipolar disorder or depression. These additional medications can help manage mood swings and depressive symptoms, providing a more comprehensive treatment plan. Next, psychotherapy plays a crucial role. Engaging in regular therapy sessions can provide individuals with the tools they need to understand and manage their condition. Cognitive behavioral therapy, or CBT, helps individuals identify distorted thinking patterns and develop better coping strategies. This type of therapy is particularly effective in helping individuals challenge and change unhelpful beliefs and behaviors. Family therapy involves the family in the treatment process to improve understanding and support. By educating family members about the condition, they can provide better support and create a more conducive environment for recovery. In severe cases where there is a risk of harm to oneself or others, immediate intervention is crucial. Or when self-care is severely impaired, hospitalization may be necessary to stabilize the individual. During hospitalization, patients receive intensive care and monitoring to ensure their safety and well-being. After the acute episode is treated, social support and rehabilitation are vital. Social skills training, vocational rehabilitation, and support groups can help individuals reintegrate into daily life and reduce the likelihood of future episodes. These programs provide a supportive community and practical skills that are essential for long-term recovery. Lastly, early intervention programs are particularly important for younger individuals experiencing their first episode of psychosis. Early intervention can prevent the condition from worsening and improve the long-term outlook. Early intervention can lead to better outcomes. By addressing the condition early, individuals have a better chance of managing their symptoms effectively and leading fulfilling lives. Experts emphasize the importance of a comprehensive treatment plan tailored to the individual's needs. This personalized approach ensures that all aspects of the individual's mental health are addressed. Many individuals have successfully managed their symptoms and improved their quality of life through these treatments. Personal stories of recovery can provide hope and inspiration to others facing similar challenges. With the right support and treatment, recovery is possible. It's important to remember that while the journey may be challenging, there is always hope for a better future. Long-term management of psychosis is crucial, especially since it can be a recurrent condition, particularly in disorders like schizophrenia. Ongoing treatment with medication and therapy, as well as monitoring by mental health professionals, is essential to manage symptoms, prevent relapses, and improve quality of life. Incorporating lifestyle changes like a balanced diet, regular exercise, and mindfulness can also be beneficial. Community support and family involvement play a vital role in long-term management. Tips for individuals and families include setting reminders for medication, maintaining a structured routine, and seeking support when needed.